Since it began in 2016, All-Can has emphasised that efficiency in cancer care means focusing resources on what truly matters to patients, whether that's time, for example time to diagnosis, quality of life or other better outcomes. And that's why we created the Efficiency Hub, a first-of-its-kind platform that collects and shares best practice examples from across the entire cancer pathway. We hope that these examples provide inspiration for action so that we see these successes replicated across different contexts to drive meaningful change. So let's have a closer look at one of these examples featured on our website to see how efficiency can truly transform patient outcomes.
For context, I want you to imagine you are a young woman, age 30, you're given a cancer diagnosis, and you're told that no one survives it. This is not an imaginary situation. This is the reality of many women diagnosed with cancer in Nigeria. Cancer is a public health crisis. As you may know, Nigeria is a highly populous country with over 200 million of us. But what you may not know is that there are less than 100 clinical oncologists to take care of these patients. So that means one clinical oncologist gets to see over 5,000 patients, and that's ridiculous. It's even worse for other African countries like Chad, Central African Republic, Burundi, that do not have clinical oncologists, right? And so patients are left stranded. They are screaming in pain. They are praying for a healthcare system that will support them on this tough battle of their lives. We said, how can we change this narrative? How can we build trust, right? How can we ensure that cancer patients are not dying due to late presentation, due to stigmatization? Oncopadi, we are a digital innovation company. We help patients make better informed decision. Now, for context, what you must know is that getting a cancer diagnosis can be very isolating, it can be very challenging, and most importantly, it can be very confusing. So a patient gets a diagnosis, they don't know where to go to, they don't know who to turn to. Many of them, going through those 6 stages. One is denial, fear, grief, and a whole myriad of emotions. And so the goal is for us at Oncopadi, or what we set up to do, is to be that companion, that friend, hence the name Oncopadi. So onco from the word oncology, which means cancer, and Padi is a nickname we all use in Nigeria to mean friend. And so we want to be that friend, that companion that helps you on this journey. So one of the things we did very on was we started by ideating amongst ourselves after seeing this problem to say, what do we think our patients will need? We went into several cancer clinics to actually talk to patients, right, and ask them questions. We conducted a couple of focus group discussions where we sat down with patients. And so we had a lot of discussions with the patients, and we were very big on putting the patients themselves at the center of the idea of the solution we were trying to build. And what we tried to do is to build trust in the healthcare system before patients actually eventually go into the hospital. And so we are increasing and augmenting that late stage presentation and helping patients go to the hospital faster, start treatment really faster, and get all the necessary clarity that they need through the entire journey that most times is very bureaucratic and very cumbersome. So we launched the app, and within 2019 into 2020, we had onboarded over 300 patients, our first 300 patients on the app, who use the app for teleconsultation, use the app to request for diagnostic services, and use the app for many other things within the ecosystem. And more importantly, now we're growing the largest online community of African cancer patients, warriors, and champions that are supporting each other, because a lot of patients have sensitive topics surrounding their diagnosis that we as clinicians, we may not be able to assist them in. But having that community helps them to see that people do survive cancer, right? Tap into that network and a lot of, resources that they can get within that community.